The first group of Afghan refugees arrived at the joint McGuire-Dix-Lakehurst military base in New Jersey this week as part of the continuing effort to evacuate those in Afghanistan who helped the U.S. effort there. The base is one of 4 military bases in the country that will provide temporary shelter for more than 58,000 refugees who were forced to flee after the United States withdrawal. Welcome back to Jersey Matters. The CDC is now urging pregnant women to get the COVID-19 vaccine. Jersey Matters' Jennifer Marin gets reaction now from medical professionals and mothers-to-be in New Jersey. Jennifer.
Larry, the chair of OBGYN here at Jersey Shore University Medical Center says ongoing studies show that the benefits of the COVID-19 vaccine far outweigh the risks for pregnant women. And although some agree, others say they will not get it.
The CDC has updated their guidance for pregnant women, now urging them to receive a COVID-19 vaccine.
This has a significant impact on pregnant women.
Dr. Scott Smilin, chair of OBGYN at Jersey Shore University Medical Center, agrees with the new guidance. He says catching the virus while pregnant is especially dangerous.
Respiratory illnesses tend to be bad in pregnancy because physiology in pregnant women changes, so that, for example, their chest compliance is not as good or different than it is in a non-pregnant state, especially as pregnancy advances.
According to Dr. Smilin, there are at least 150,000 pregnant women who have been documented to have received the vaccine during pregnancy.
You know, that's a lot of information that we can glean safety information from, and we know clearly that the risks are exceedingly low.
Asisa Agudosi is one of them.
We take all these other vaccines, why not this one? Especially when so many people have been affected, and I've heard and read about babies dying and mothers dying.
Asisa says through research, she realized the vaccine could possibly help her baby fight the virus. Dr. Smiling says in some cases, that's true.
There is evidence that antibodies can be passed to the fetus. So that is potentially a way to immunize your newborn against COVID.
But not all mothers feel like Asisa. Marjorie Catone is currently 8 months pregnant, but she lost a son a few years back, and it's changed her perception of vaccines.
I kind of was down the traditional medicine route my whole life because that's just what I knew and what I practiced. And then we lost our son to vaccination.
She says he didn't respond well to the traditional childhood vaccination schedule, and the experience convinced her to opt for natural immunity for her family.
There are no long-term safety studies for a pregnant woman or just a child or an adult. This was rushed through.
She tested positive for COVID-19 a few weeks ago and says her natural immunity was enough to fight it.
It was the most mild symptoms. I've been so much more sick in my life, and I hate to say that because I know people have died from this.
She adds that miscarriages relating to the vaccine are also a concern. But according to Dr. Smilin, the risk of miscarriage in all pregnancies, regardless of vaccination status, is around 11 to 16%.
What's been demonstrated by the data that's been reviewed thus far in pregnant patients receiving the vaccine is that the rate is no different in patients who've received the vaccine than in those that haven't.
Now, as for couples who are trying to conceive, many say they're afraid the vaccine could intervene. But Dr. Smiling says that studies have shown that the vaccine does not cause infertility in women or in men. For now, reporting in Neptune for Jersey Matters, I'm Jennifer Marin.
All right, thank you, Jennifer. Next on Jersey Matters.
In just a few short weeks, we'll have classrooms filled with students, but not as many teachers this year. That's just one of the many challenges that New Jersey schools are up against, and we'll have that story coming up next on Jersey Matters.